Welcome to my YouTube video on cardiovascular disease. This is Dr. Ellen Rencher, and if you're not familiar with me, I am a clinical nutritionist in functional medicine. I'm a chiropractor, and I began my career in cardiac rehab as an exercise physiologist. This is the first of a series of 5, and today's topic is cholesterol, the dreaded cholesterol. Now, cardiovascular disease has been the number one cause of death since 1950. And for over the past 50 years, the traditional treatment and prevention guidelines have been about the same. Avoiding fats, especially saturated fats and cholesterol. Lowering cholesterol levels with medications called statins. And about 71% of people with cardiovascular disease are taking statins. So how are we doing? Are we winning the war against cardiovascular disease? Well, briefly for a decade, beginning around 1984, it looked like we were winning the war when the numbers improved for men at a time when men were giving up smoking and smoking was being banned from work and hospitals and various public environments. But at the same time, the numbers began to rise for women. And now, today, more women die from heart attacks than men. Yes, you heard me right. More women die from heart attacks than men. The medical costs of cardiovascular disease are projected to increase by 200% for men and women over the next 20 years. So with the numbers rising and 71% of those with cardiovascular disease on statins, one has to wonder if cholesterol really is the culprit. And if not, what should we be focusing on for better health? Let's take a look at cholesterol around the world to see if it's truly a risk factor. In Spain, their LDL levels, known as the bad cholesterol levels, are very similar to ours in the U.S. Yet Spain has 50% less cardiovascular disease than we do. In Sweden, they have higher cholesterols than we do. Yet 50% less cardiovascular disease. And the Australian Aborigines, low cholesterols, yet high levels of cardiovascular disease. So with all these variations, how can we say that heart disease is due to cholesterol? And it may interest you to know that only 20% of your cholesterol level in your bloodstream comes from the foods you eat. Your body makes the rest. So why is your body making all this cholesterol? Well, it's made in the liver and it has many roles. It's essential for every single cell membrane in your body. It's needed to produce these bile salts that digest your fats. Cholesterol converts to vitamin D when the skin is exposed to sunlight. And the largest amount of cholesterol in your body is in your brain. So it seems that cholesterol is rather important. Cholesterol is needed to make your sex hormones and your stress hormones. The fear of cholesterol, it's ingrained in us. What about plaque, clogged arteries, and why would my body make too much cholesterol? Well, cholesterol is needed for repair. Cholesterol responds to the amount of damage that the inflammation has caused. And the LDL and HDL that we've heard so much about are the two that are responding to this inflammation. The LDL is known as the bad cholesterol, leaves the liver and it goes out to the arteries, whereas the HDL picks up the excess and brings it back to the liver, and that's why it's called the good cholesterol. So let's see that what happens here. So in this artery, in this photo, you're seeing the high blood sugar is damaging that inside wall of the artery. It's scraping and scraping and scraping that interior wall. And then the patchwork is done by the cholesterol. It's coming in there and it's doing patchwork. I like to think of the LDL as a fire truck. It's coming out and responding to the inflammation. It's put out the flames. It's doing a good job. And remember when I said that the cholesterol is needed for every single cell membrane? Well, over time, when that inflammation disappears, that wall will look just like the old artery wall. It'll repair and look normal. And the excess will be removed by the HDL. And this occurs if the liver is not loaded down with toxins, if you have a properly functioning gallbladder and digestive tract, and of course, if the inflammation goes away. And that is why I recommend to my patients a detox program at least once or twice a year, because it's going to get rid of all those factors and help your body function like it should be doing. But what if the chronic inflammation persists? So here's a normal artery. And if you go over to where it says the cross-section of that artery, you see that white circle there? That's that inner wall, the endothelial tissue. And that's what becomes inflamed, which is normally very flexible. And outside of that is the muscle that allows the arteries to pump the blood to our tissues. In the second portion of the artery, second photo, we see an artery with inflammation. And you see that now the muscle's getting kind of weak and weepy, and the opening is not as large. And just picture the plaque being in there trying to cover all that inflammation. Not much of an opening, and therefore high blood pressure. In the third picture, you see this bulging artery, and that bulging portion is a very weak wall. And if you look over to the cross-section, you see that there's hardly any muscle there now. And that's a very thin wall, and that's what we call an aneurysm. And an aneurysm can rupture and cause a stroke. Okay, so we don't want that, so how do we calm that down? Get rid of the inflammatory foods. Refined grains such as cereal, breads, crackers, pasta. Red meats. Now there's a difference. Grain-fed is inflammatory, while grass-fed is actually good for you. Trans fats. Anything that's fried is a trans fat. Chips, commercially baked goods, they're not going to have good fats there. Cookies. Margarine. Ironically, we used to recommend margarine instead of butter. I'm telling people, go back to grass-fed butter. It's better for you. And those spreads that are saying made with olive oil, you're going to see on the label that it's hydrogenated. And that means it's a trans fat, which means it's not healthy. Soda, anything that's sweetened, any kind of drink that's sweetened is going to cause inflammation. And dairy, limit the amount of cheese and milk. There is some benefit to eating these, but limit the amount that you eat because it can cause inflammation. Other things that will increase the need for cholesterol, notice I'm saying the need for cholesterol, are smoking because toxins clog up the artery, clog up the liver, and causes inflammation. Alcohol, sugar, and also affecting the liver. Lack of exercise, you'll have a lower HDL that's going to carry the cholesterol back to the liver. And it's also a stress reliever. Stress causes inflammation. And go to your dentist for regular care because oral or gum health can directly affect the heart vessels. So the new approach to a healthier you would be not to simply lower the cholesterol, but lower the inflammation and toxins, lower the actual cause. An anti-inflammatory diet, well, that's basically any diet that avoids the inflammatory foods. If you need a guideline, I always recommend the Mediterranean diet. It's balanced with protein, produce, good fats, and some grains. And supplements, yes, there are supplements that are going to help you lower your inflammation, improve your liver, gallbladder, and digestion. Notice this is the focus for improving your cardiovascular system. If you want a jumpstart on how to improve your cholesterol numbers and impress your doctor, I always recommend the 21-day detox program because it's going to be, in the 21 days, you'll be avoiding inflammatory foods, getting rid of toxins, and you'll have a greatly improved digestive tract. It's a really good jumpstart. We have a 10-day one also, but I would say that most people need the 21-day at least to start. So, are you still afraid of red meat? I can just hear people saying, I've lowered my cholesterol numbers by cutting back on red meat. Well, I want you to ask yourself, was it grain-fed or grass-fed? Most likely it was grain-fed, and that is inflammatory. The grass-fed has more omega-3 than fish. But be careful, this is another label that you need to read. It must be 100% grass-fed. Because if it says grass-fed, in this country, they allow them to say grass-fed when most of the time that cow was fed with grain, and at the very end, they fed them some pellets of grass, and they say grass-fed. So look for that label of 100% grass-fed. You'll be getting a lot of omega-3, which is anti-inflammatory. Eat your eggs. Stop being so afraid of eating cholesterol. It makes me so mad when I see people eating egg whites because they think that they're going to be increasing their cholesterol by eating eggs, when all the nutrition and the things that will lower that cholesterol level and improve your heart health is in the yolk. The vitamin D, all those B vitamins, choline, which helps the health of your blood vessels and your liver and will actually lower your cholesterol. Summary for today, cholesterol is the symptom, not the cause of cardiovascular disease. Cholesterol rises in response to inflammation. Tackling the inflammation will lower the production of cholesterol and the need for that patchwork in your arteries. Getting rid of toxins will enable the body to get rid of the excess cholesterol. And beware, medications that lower your cholesterol are not addressing the inflammation. Chronic inflammation and a very low cholesterol puts you at risk of artery rupture, poor brain function, and low hormones. That being said, I am not suggesting that you stop medications on your own. Go back to your doctor and work on decreasing your inflammation levels, decreasing your toxin levels, and you will see your cholesterol numbers go down. So that's it for today. I hope I've changed your perspective on cholesterol. And our next topic will be blood tests and markers to ask your doctor to add to your next blood test. Thank you for joining me, and I look forward to giving you our next topic.